Early warning signs of colon cancer. You should not ignore. Foreign signs of colon cancer you should not ignore. Colon cancer is often called the silent killer because there may be no symptoms until the tumor has become large enough to cause problems. Over new cases of colon cancer are reported each year in the U.S. It is actually the third most common cancer in both men and women and is responsible for nearly deaths each year. Colon cancer is a disease in which the cells in the large intestine become abnormal and multiply uncontrollably. While there's no way to know for sure whether colon cancer will develop, there are some early symptoms that might indicate a problem. Some signs mentioned in this video may be subtle, while others may be more obvious. Before we share the secret, please subscribe to our channel and hit the bell button so that you never miss secret health tips. Changes in bowel habits. The average age when you're most likely to get colon cancer is years old. Half of the people diagnosed with colon cancer are over years old, but younger people can get it too. Bowel habits are often the first sign of colon cancer. A healthy colon usually has a regular bowel movement every day or two. The stool should be soft, brown, and easy to pass with no blood. If you notice any changes in how often you go to the bathroom, or if your stool becomes hard and difficult to pass, it might be something concerning to look after. Diarrhea. Diarrhea, or loose bowel movements, is a common problem for people with colon cancer. The term diarrhea technically refers to the passage of 3 or more unformed stools in a period. Diarrhea is a symptom that can also be caused by other conditions, including irritable bowel syndrome, lactose intolerance, and inflammatory bowel disease. The National Cancer Institute reports that some people may experience diarrhea because their colons are infected with bacteria or parasites. Constipation. It's no secret that the colon is responsible for waste elimination. It's also responsible for the absorption of water and nutrients from the food we eat. This can lead to a situation where the colon becomes clogged and unable to function properly. The result is constipation, which can be quite uncomfortable and embarrassing. Constipation may not seem like much of a problem at first, but it can be an early sign of colon cancer. In fact, according to one study, more than % of patients diagnosed with colon cancer had experienced constipation before their diagnosis. Constipation can be caused by a variety of things, including medication side effects and a lack of physical activity. Sometimes it's hard to tell the difference between normal constipation and something more serious like colon cancer. If you're experiencing constipation that lasts longer than 3 days, talk to your doctor, especially if other symptoms, such as bloody stools and abdominal pain, are present. Blood in your stool. Colon cancer is one of the most treatable cancers if detected early. The 5-year survival rate for colon cancer is %. Unfortunately, 1 in Americans will develop colon cancer during their lifetime. The earlier it is detected, the higher the survival rate. Blood in your stool can be an early sign of colon cancer. The colon is the part of your digestive system that stores stool before it's eliminated from the body. Bloody stools can be caused by many different types of cancer and other conditions, such as ulcerative colitis, diverticulitis, and hemorrhoids. Blood in the stool is usually due to inflammation or injury in the large intestine. It can also be from bleeding from other parts of your digestive tract, such as from ulcers in the stomach. A bloody stool can also be caused by certain medicines, such as antibiotics like ciprofloxacin, antidiarrheal drugs such as lactulose, or iron supplements. Bleeding from the rectum. Bleeding from the rectum might be a sign of colon cancer. The rectum is the last part of your large intestine, which is about 5 inches long. It's where waste leaves your body. However, bleeding from the rectum is fairly common, and most people with this symptom do not have colon cancer. A number of other conditions that cause bleeding in this area are hemorrhoids and anal fissures. Bleeding from the rectum may also be caused by a polyp or other growth on the surface of your colon. Thanks for watching, and we'll see you in the next one. Subscribe for more health tips.